Obstetric cholestasis should be something that all pregnant women are advised to monitor for the signs and symptoms of during pregnancy. And if you had ICP or obstetric cholestasis in pregnancy, let me know your experience below to help other mums who have recently been diagnosed. And the signs and symptoms that you should be aware of in pregnancy include itching all over your body, it being worse at night, and most commonly the itching of your palms of your hands and the soles of your feet. And whilst most of us know it as obstetric cholestasis, literally meaning cholestasis of pregnancy, the medical term is intrahepatic cholestasis of pregnancy. And this is the RCOG Intrahepatic Cholestasis of Pregnancy Information Patient Leaflet, which I can highly recommend you go and read. And for anyone diagnosed, the ICP Support Facebook page is a brilliant source of support for anybody who is diagnosed with ICP. Now, in terms of risk factors for developing ICP, having had a first degree relative, so if your mum or your sister had ICP, or if you yourself previously had ICP, you're more at risk of having it again in future pregnancies. It's much more prevalent in winter months. Having a South Asian or Pakistani family origin, or having low levels of vitamin D and selenium also put women at greater chance of having ICP in pregnancy. And the risks of ICP include anxiety, mental health problems, sleep disturbances and discomfort due to itching. There can be some medications that will help with that itching because it is really an irritating and hard symptom to be able to deal with. Gestational diabetes and preeclampsia are also higher. Long term, you're more likely to experience hepatobiliary disease, diabetes, thyroid conditions, Crohn's and psoriasis. And for babies, it can increase the chance of having meconium stain liquor in pregnancy. I've done videos on that before. It can also increase the chance of infection, admission to a neonatal unit and prematurity too. And the other risk, which is the big risk that most women worry about, is the stillbirth risk. So in women with mild ICP, the rate and the chance of a stillbirth happening with mild ICP is comparative to your everyday general population. In terms of moderate ICP, the risks of stillbirth go up slightly, which is why an induction or a caesarean is recommended from 38 to 39 weeks. And for women with severe ICP with bile acids of more than 100, this is where induction or caesarean birth is timed on an individual basis, weighing up the severity of the ICP with the potential implications of premature birth as well, depending on how far along you are into your pregnancy. It's also why regular blood tests happen during pregnancy to see whether or not it remains mild ICP or whether it develops into moderate or severe ICP. It's a question worth asking to your healthcare provider to find out how often you need blood tests in your pregnancy. And this is open access on the RCOG website, the guideline for healthcare professionals. And some women will be prescribed certain medications with ICP. Now, this depends on your local guidelines, but also what is going on with your ICP, the levels in your own medical history. But sometimes things like vitamin K, some creams, urso, or chlorphenamine, which is an antihistamine, commonly known as Piriton, is sometimes used. And this is one of the benefits that induction of labour can offer. And what they have found from the research is that there is no difference in operative or assisted births with obstetric cholestasis induction of labours compared to control groups. And women who have obstetric cholestasis who are induced between 36 and 40 weeks gestation don't have any increased rates of assisted or operative births compared to induced controls at all. And ICP is one of those conditions where induction of labour literally can be life-saving for mums and babies. And in terms of follow-up, it is recommended to have repeat liver function blood tests 4 weeks or more after birth. And for the majority of women, the itching and symptoms will subside in the first few hours and days. Any continued itching, though, needs an assessment through your GP.